Welcome to another cosmetic breakthrough by Pharmaclinix. Introducing new dermarollex for instant visible skin improvement.
We at Pharmaclinix have perfected microneedling procedures using dermarollex to induce new collagen formation following multiple micro-injury to the skin. Dermarollex, when used with our very powerful cosmeceuticals, gives rapid visible results as active ingredients are better absorbed into the deeper layers. Microneedling is clinically proven to give permanent and physiological improvement without hyperpigmentation or scarring. It is a non-ablative process with holes only 3 to 5 cells across, leaving normal epidermis in between while creating 250 holes per square centimeter with 16 movements. This study demonstrates that these microchannels increase the penetration of molecules deep into the chosen target layer of skin. Here, Indian ink is seen penetrating the dermis very quickly. This image shows 2 puncture marks separated by normal untraumatized epidermis with the preserved corneum stratum. This study shows a dramatic increase of collagen, elastin and blood vessels after 6 months of microneedling of the thigh with a 400% increase in collagen. The epidermis and dermis are denser and thicker, promoting new blood vessel synthesis without damaging the epidermis. DERMAROLLING is a precision-engineered medical-quality handheld roller with 192 surgical stainless steel microneedles. They are available in 12 sizes, ranging from 0.2 mm to 3.0 mm, including the narrow pen rollers for more precise and targeted treatments, for example, single long stretch marks or crow's feet on the face. Microneedling creates multiple microhemorrhages to the dermis with rapid epidermal closure. Platelet growth factor is activated, which triggers the healing cascade with new collagen and elastin, which continues for up to 12 months. In general, the longer the needle, the greater the subcision with better collagen response. The dermarollex is easy to use. Roll at the same intensity 4 times each, vertically, horizontally and diagonally. These total 16 movements give up to 250 holes per centimeter squared. More intense rolling is required for subcision of old fibrous bands. Stop rolling when skin resistance is overcome. After treatment, wash the dermarollex in sterilizing fluid. Pharmaclinix have specific protocols for hyperpigmentation, scars, wrinkles, and stretch marks. The choice of the needle lengths required is dependent on the depth of the lesion and the downtime tolerance by the patient. Melasma can be treated with needles less than 0.5 mm, while atrophic acne scarring may require needles up to 3.0 mm long. Dermarolling can be used for wrinkles, stretch marks, atrophic scarring, graft edge scarring, skin laxity, and a month after botulinum toxin injection. There are, however, a few contraindications. The skin disorders in which this should be avoided are irritated, infected skin along with active acne and inflamed skin for any reason, including eczema, psoriasis, or severe solar keratosis. Raised moles, warts, and open wounds should not be dermarolled. Keloids should be avoided as well. Patients with a bleeding tendency due to aspirin, warfarin, or heparin should not be dermarolled. Patients with hemophilia, von Willebrand's disease, Christmas disease, or ITP should not be dermarolled, as uncontrolled bleeding may ensue. In addition, patients who are poorly controlled diabetics or on oral steroids should not be dermarolled, as healing may be delayed. In resistant skins, photo-Ajax for 1 month is quite sufficient. For sensitive skins, anti-Ajax serum for 1 month is advised. Post-procedural care. Clean skin with saline-soaked gauze. Apply anti-Ajax serum immediately after procedure. Apply Sunblock X before patient leaves. Longer needles cause some superficial bruising, which subsides in 3 to 5 days. Shower with lukewarm water to remove any serum which oozes from the skin to prevent crusting. Avoid makeup for 5 to 7 days when using long needles. Now follows the practical demonstration of a patient with multiple indications.
Here I have my tray that I prepare. In this bowl here we have lukewarm boiled water for rinsing the derma rollers during the procedure to remove any dead cells and congealed red blood cells. Here we have gauze swabs with normal saline solution soaked on the same day of preparation. This is for the purposes of soaking the skin after you've done the procedure. And in the third bowl is an empty bowl where we discard the used gauze swabs. I have here in addition amla cream. I also keep pulled up xylocaine or lignocaine injection for local infiltration if the patient finds that you need some additional anesthesia. Here we have the 2 sizes that we shall be using today. This is the 1.5 millimeter derma roller. Then we have the 3 millimeter roller, which is for the subcision of the deep acne scar that this subject unfortunately suffers from. I also have here the cling film. Some people choose to use Tegaderm dressing, putting it on top of the amla cream for greater and easier penetration of the local anesthetic. The subject of our treatment today is a 42-year-old female from the Indian subcontinent. She has spent most of her lifetime in the Indian subcontinent. If I tilt her head, you can see from the side of the face as I stretch the skin that there is considerable atrophic acne scarring. If you also turn it to the other side, you can see similar lesions but more ice pick scars here. So it's considerable acne scarring on the cheeks. There's some acne scarring on the nose. There's a box scar here on the nose. There is certain amount of superficial wrinkling on the forehead. As you can see when we pull the skin up, there is laxity there. And there is also greater hyperpigmentation around the area of the temples and some crow's feet wrinkles around here. Most of these lesions, except for the acne scarring, are the result of photoaging. Over the years, she's lived most of her life in the Indian subcontinent and has been exposed to UVA and UVB most of her life. This is the tube of amla cream that I've just opened up. I will be applying liberal quantities of amla to her skin. I will not be rubbing it in. I will be just purely applying it to her skin. That's very important to remember. And the neck, as you know, you get considerable number of necklines, horizontal necklines, which are where the skin folds normally and forms wrinkles. Regions where I'm going to be using the longer needles, I apply even greater quantities of amla cream, which is predominantly the cheek areas. Now I'm going to show how I choose to use the cling film. The reason I use the cling film is it's a nice broad sheet which you can apply easily to occlude the area. Now what I do is I apply over the nostrils and then I press in the area, and as it's rolling off, she is not obstructed from breathing at any point. So you've done the upper part of her face now. Now I proceed to apply the same thing to the lower part of her face. I'm now just cleaning the skin with the boiled water which we have there, the swabs, to remove the excess amla cream which has now been working on the skin for quite a long time, and so it should have numbed the skin. I'm now just applying dry swab to take off any excess water. Before we roll the face, what I am going to do next is I'm going to apply ACNEX cream on it. It's an excellent bactericidal cream, so that if there are any bacteria on the skin, they will be destroyed within the next 5 minutes. I'm just going to infiltrate this. Just feel a little smart, sharp needle into the skin, okay? This is just to infiltrate the area. I always keep a couple of swabs in my hand while I'm rolling, so that I know that this area is well anesthetized. I'm rolling horizontally at the moment to create sufficient pressure to cause enough holes in the skin. Because this is quite tough old scarring we have here. As you can see, I'm rolling with the blood because the platelets are very, very good for actually inducing collagen, so that the bleeding is not removed, it's left, the blood is left into the skin and rolled into the skin. Where I apply more pressure in areas where there is considerably more scarring. I clean the dermaroller in the boiled water. Now I'm going to apply the roller horizontally like this. Now I'm going to be applying the normal saline dressings. This area that we've done with 3mm microneedles is for the acne scarring, where we had a lot of subcision that needed to be done, and therefore it was important that there was sufficient pressure applied with long enough needles to get good outcomes. Now I'm going to infiltrate this area of the skin with some lignocaine injection. Now I'm rolling this side of the face where the acne scars are predominant. I'm going to do the vertical movements first. The procedure itself is not difficult, it's a very easy procedure. Just make sure that there is enough anesthetic available so that the patient finds it reasonable to tolerate the pain. What I do is I use the saline dressings in between to soothe the area, because you're causing a fair bit of trauma here, because you do need the subcision. There is old scarring here. Without it, you will not get good outcomes, so you do need to do the subcision fairly intensely. Now I'll be removing the tape on the 1.5mm needles, which I'll be using for the rest of the face. We do not need to use any longer needles for this, so this 1.5 is sufficient to do the rejuvenation treatment for the rest of her face. This is the basic foundation of how we carry out the procedure. What you must be always aware of is the patient's need of pain control. At the time when you're carrying out the procedure, make sure there is sufficient amla cream being applied, there is sufficient time given for occlusion, and also local anesthetic lignocaine is always pulled up and ready to be used as necessary on a PRN basis. Thank you.
Short-term results of the patient treated with 3mm dermarollex. The Day 2 photo shows superficial bruising and swelling of the skin. The Day 5 photo shows that the bruising and swelling has resolved. These are photos of a patient treated weekly with 0.2mm dermarollex following the scar treatment protocol in Dubai. These are photos of a patient treated with 3mm dermaroller for chronic acne scarring. For more information, please log on to www.pharmaclinix.com.